Welcome back to PNB Wellness Academy. Today we're continuing our anticonvulsant review with 3 medications you may encounter on the PMHNP boards: Oxcarbazepine, Topiramate, and Gabapentin. These medications are important because although they are anticonvulsants, you should not automatically assume that every anticonvulsant is an effective mood stabilizer. Let's focus on the high-yield associations you need to recognize. First is Oxcarbazepine, also known as Trileptal. Trileptal is chemically related to carbamazepine, but evidence supporting its effectiveness as a mood stabilizer in bipolar disorder is limited, so it is not considered a first-line mood stabilizer. One of the most important adverse effects to remember for boards is hyponatremia. If a patient is taking Trileptal, develops a headache, confusion, weakness, or other symptoms consistent with low sodium, think hyponatremia and check their serum sodium level. Compared with carbamazepine, Trileptal generally has fewer clinically significant drug interactions, but hyponatremia remains an important safety concern. Next, we will discuss is Topiramate, also known as Topamax. Topiramate is an anticonvulsant, but evidence does not support it as an effective primary mood stabilizer for bipolar disorder. For the boards, focus instead on its characteristic adverse effects. One of the biggest associations is weight loss, which can be significant. Topiramate can also cause cognitive slowing and word-finding difficulty, which is why you may hear the nickname Topamax. Other important adverse effects include kidney stones, metabolic acidosis, and Topiramate is also used for migraine prevention. So recognize that indication if it appears in your clinical question. For your boards, you want to remember Topiramate equals weight loss plus cognitive slowing. Finally, we have Gabapentin, also known as Neurontin. Gabapentin has not demonstrated sufficient efficacy to be considered an effective mood stabilizer for bipolar disorder. Instead, for boards, you want to associate gabapentin primarily with neuropathic pain and seizure disorders. It may also be encountered in an off-label psychiatric use for anxiety-related disorders, but do not choose gabapentin simply because the question asks for a bipolar mood stabilizer. Common adverse effects include sedation, dizziness, and ataxia. Gabapentin is also renally eliminated, so renal function is important when considering dosing. So here's a rapid review. Trileptal, you think hyponatremia. Topiramate, you want to remember weight loss, cognitive slowing, and word-finding difficulty, also kidney stones and metabolic acidosis. With gabapentin, you think neuropathic pain, sedation, dizziness, ataxia, and renal elimination. And remember, the bigger board lesson: just because a medication is an anticonvulsant does not mean it is an effective mood stabilizer for bipolar disorder. Thank you for learning with PNB Wellness Academy. Save this review for your boards and follow for more. See you in the next review.